Welcome to Kian's Kiosk, insightful ruminations on the continuum of care.
This is Kian Sane, and thank you for joining us at Kian's Kiosk. I'm so thrilled today to spend time with my esteemed guest, Jennie Hansen. Jennie and I go back probably more than a decade now, and she is an amazing individual as a person and as a contributor and mover and shaker and creator in our healthcare system. I'm just going to quickly go through her background. She was an executive at Unlock, which was the first PACE program in our country, a fantastic model for providing care. She was a former CEO of the American Geriatric Society, former president of AARP. She's been on multiple boards, including Dignity Healthcare System, and currently on Scan Health Board. And just more important than all of those amazing accomplishments and positions, she cares and she makes change and creates incredible paths for all of us as citizens and Americans to have a better healthcare. So Jennie, welcome to our program. I'm so thrilled to spend time with you today.
Thank you so much for having me, Kian. This is a pleasure and an honor.
Jennie, you have done so much and for so long, and you continue to do that. I'm curious, currently, you're not affiliated with any association or organization. You're not an employee anywhere. So how does that affect your philosophical and objective view of how our best solutions can be brought to market? Given you can be totally objective, you're not anyone's employee. Does that make a difference now versus before?
It does. I feel a degree of freedom and liberation to have a chance to both think through as well as say some things that I might not have said when I would be, say, a chief executive.
I see. So are you saying you're less careful with your words? Because as much as you've accomplished whatever you did, are you saying you're now going to accomplish things faster and easier?
Well, I don't know that faster or easier is ever a path that dealing with kind of gnarly problems. But I think I've had a chance now to take a look at both what has been and what we all hope to be in a way that I can say, not so much loosely, but perhaps with a different context and information, and perhaps a different level of visible passion.
That is wonderful. I want to congratulate you, Jennie. You've won many awards and been recognized so many times for different things, but I'm thrilled to share with everyone that just this week you were the recipient of the Healthcare Leader Award from the Academy of Nursing, where you're a fellow. And so that's, I'm sure, a thrill, and you can tell us about that. And also this week, UCSF has given you a medal. And when I asked you a medal, what's the name of the medal, you said that's just a medal. That's what it's called. And it's every couple of years, I believe, 3 people get it. And so tell us about that and tell us the impact of that in your work going forward.
Well, thank you. You're absolutely right. I am a little embarrassed by the opportunity to get awarded in these different ways. But first and foremost, every time I get them now, I realize it just offers me a platform to maybe say some different things, but also to feel an obligation that when you're given this recognition of any kind, it's never an endpoint. It is actually a vehicle to use that visibility and perhaps that voice to further articulate what's important for society. So in quick, the 2 awards tonight, I'm receiving what is called, the UCSF Medal, accorded by the Chancellor of the university. So again, tremendously thrilled and honored. One of the other awardees is actually 221 Nobel Prize winner. So this is incredible because this is my alma mater. And so, again, I hope I am already doing some things with UCSF now at helping their emergency departments become better prepared to deal with older people. The second award that you mentioned initially actually was announced this week, will be accorded at the end of October. But this is the Academy of Nurses throughout the country. There are just about 3,000 of us, and that's 3,000 of over 3 million nurses in the country, and the opportunity to be recognized for the PACE program that I'm sure we'll talk about, the care for older persons inclusively. That has been the reason I'm getting the award, I'm sure.
Well, we're thrilled for you, and we're grateful for all of your contributions. They, I know, are not done, and you continue. So what are you working on nowadays? What path and what service and what problems are you solving for all of us?
Right. I already mentioned that I am real committed to seeing that emergency departments are going to be better prepared for those of us coming into their EDs who happen to be older, have multiple conditions, but especially with a strong focus of understanding that many of us may have cognitive issues like dementia or Alzheimer's. So that's probably my primary active work here in San Francisco. Nationally, the whole aspect of how long-term care will be financed in the future. This has never been well done, and we continue to have the struggle of how we will both plan for, have available, and pay for care as we get older and need some added services, and especially since most people would prefer not to go into a residential facility. So how do we take care of ourselves? How do we take care of our family members? The issue of health equity is something that has been part of my life since the very beginning. The fact that this is focused on far more today for all the reasons that have happened over the past 2 to 3 years gives us an opportunity to have that wedge of elevating more equitable and appropriate care for vulnerable populations. And dementia is an area that I am spending a lot more time on over the past couple of years. And just because if we're lucky enough to reach 85, anywhere from 30 to 50% of us will possibly be touched by dementia, if not Alzheimer's.
Wow. So you know these numbers better than I, but you and I, and also just in general, Independa, are so aligned in the area of health equity, in the area of meeting people where they are. When we talk about a PACE program, that to me is all around not just saving money for the system and reducing anguish and improving care and outcomes, but also respecting the individual. It's really all about respect and where we want to continue living and being given the options. And I know you've coined the phrase being a sense maker, and it's sometimes hard to make sense for some of the things that go on just based on payments and inertia and let's just say maybe lobbyists and so forth. But in a PACE program, what I find fascinating is that if you take 100 people as we age, and when we become candidates to move out of our home, 93 of us never even consider that. So it's so visceral for us to stay where we are and do that until our last breath. And so PACE helps with that, obviously, and is all geared towards that. And then the other 4 look into moving out and going to some community, and 3 of them decide not to. So really, the entire senior living base is 4% roughly of people who could be candidates for that. And if PACE can help populations stay where they are longer, safer, more comfortably, which is really literally our vision as a company, and to delay or eliminate even the next stage of care, that changes people's lives. It changes the costs in the system. Tell us more about what's happening with PACE, more about the growth of that program through various states, and where you see that going. Being the founding Unlock member of PACE, and then you turned that into law way back, I think it was in 1977.
Right, 97 actually.
97, I'm sorry.
Right. Well, it's wonderful that it's now a program that's approved and operating in 31 states, and the numbers keep growing. So I'm obviously delighted. Here we are almost 25 years after the passage of that law, but it's taken some time to focus on this, in part because everybody does have a difficult time thinking of themselves, frankly, as needing care. And as family members, we all kind of hope our loved ones kind of stay as well as possible. And also, we stave off that kind of thinking. But the reality is the numbers of us marching down the pike are just too big to miss. So because of that, I think PACE and programs somewhat similar or tools of technology, such as Independa's work, is in a position now to be picked up and scaled just because the need is so great. And I think your work, your team's work, and helping people maintain their best well-being, their highest function, their ability to socialize, take care of some of their medical issues kind of at the early end, will allow us to stay more independent and social in our own homes and communities. So I think, to your point, that's what we all want. And I think that's why PACE and the work of Independa, other programs, is going to be on the uptake.
Yeah, we certainly see that, and we appreciate that thought. Really, we're passionate about the same area. We approach it really from a technology standpoint. As you know, our partnership with LG is really both unique and compelling in our view in the marketplace, where you can take your TV and turn it from a commodity appliance into a bidirectional window to the world, where we have an ecosystem of health offerings, including telehealth, 24/7 access to doctors and dentists and therapists, as well as access to lots of education and content. So we have WebMD content for health education. We have exercise content from our friends at Spiral 100. Coro Health gives us faith-based videos, music therapy for dementia. We have Senior Savvy providing wonderful education for technology use, and there's more and more coming. We have in-home lab tests. We have pharmacy discount, all of it curated in one place. And it strikes me as your background, and you've spoken to this in the past, where if we provide an ounce of prevention, an ounce of socialization, an ounce of investment up front and upstream into a person's life, then we could really not just improve the quality of life and improve the care, but certainly reduce the costs. And I think if you were to maybe speak to that on how our system differs from maybe other systems in other places around the world that might reallocate their funding for healthcare differently, and where we might be able to learn from that.
Well, there are two big points that come out of your question here. One is how we spend money currently and how it's approved to be spent. So right now, payment is really made for illness and problems that show up visibly and must be treated. And so that's payment right now is on a sick system. You have to be ill or show it doesn't pay for food if that is what maintains you. But if you're malnourished and you've fallen, you get into the hospital, and that's paid for. So the payment system has to really get redistributed from illness, trauma, correction to what you're doing is to help a lifestyle health approach to well-being be almost automated, intrinsically, and simple. And it's intuitive, and your technology allows us to keep our, quotes, health and not fall into medical as soon, or use your tool as a curated way to help manage your health without having to trudge to the doctor's office. There are things that you can do now at home and self-manage that weren't available 20 years ago. So I think using natural tools like a television, which everybody has, or at this point a cell phone or anything like that, that becomes such a new literal platform for well-being.
Exactly. And I think in our view anyway, and with our PACE partners, it's not an either or. It's just a reallocation and a sequencing of energies, where if you help someone socialize more, if the car keys are taken away, for instance, and so someone's social circle may have collapsed, and so getting to a doctor may be harder, but maybe a transportation solution helps with that. Or if it's bad weather, maybe walking to the bus stop is much more of a challenge. So just simple things that go a long way towards making sure you have preventative care and you have wellness and you have have nutrition and all of those things that then lead to a much healthier life. And I've been taught much of this by our Chief Medical Officer, Dr. Richard Delapena, and I know you and he shared backgrounds and training and a shared vision, and him as a doctor and you as a nurse. And he always gives an example of healthcare happens when people leave the doctor's office, not when you're with the patient. So, so it's absolutely correct in our view to help in any way to reallocate energies up front. And we see the results of that. And so hopefully our country will heed and make changes. How can we affect those changes, Jennie? How can we raise the right voices to the right people and affect change that way?
Well, I think oftentimes we want to reallocate services and cost, just as you say, but that is so hard driven into policy and payment. So I think what you're doing is that there are models of systems like health plans, Medicare Advantage health plans now, PACE programs that have funding that is much more global. And that global payment allows the system to reallocate it. But if you, say, wanted to get payment to have meals, or it's really hot weather and you needed to bring in a fan or a small air conditioner, that doesn't get normally paid for, and yet that would contribute so much to the person's health as well as medical clinical systems. But the payment models now don't do that, but MA systems, PACE programs could do that, and they have the function and authority to reallocate some services. And so I think that's one way to really go with these value-based providers that give a flexibility normally not in a Medicare program at all.
Well, anecdotally, Jennie, I was speaking with a CEO of a PACE partner of ours program, and partner meaning customer. And what she was saying is that they sometimes replace a rug in someone's home because the rug may have turned upwards in certain areas and you can't really keep it down, and that could be a cause for a fall. Or that they would install handlebars in the bathroom, grab bars. And so, you normally don't think of healthcare along those lines, or like you said, buying an air conditioning unit. But it's very clear that if you care for the person in the best way possible, like they were your own loved one, then you prevent really much more expensive, worse things from happening. So it's so intuitive and it's so simple. So whatever ways that we can get to that point is I think, really important. You're a member of the board of SCAN, and I've been a fan of yours from closer, but a fan of Dr. Sachin Jain for a long time when he was the CEO of CareMore, and he used to talk about social engagement as being such a vital component to healthcare for the elderly. And he, most CEOs at the time wouldn't say that. Tell us about SCAN's great work and where you see that model hopefully helping more and more people over time.
Well, I'm totally delighted that Dr. Jain is now our CEO. And to your point, long ago, he recognized that loneliness and isolation was actually a factor that caused clinical decline as well as mental decline. And most leaders, most healthcare leaders, would not be thinking that way. They'd be thinking about what's your diabetes reading, what's your blood pressure reading. But he opened up the frame, and sometimes it's just really important to have a well-accomplished physician be the messenger, that this is the way we should be thinking about people's function and their well-being and their quality of life. And if you have a good quality of life, if you feel like you're connected to other people, that you have enough to eat, that you know that you can get medical care when you need it, that peace of mind adds to well-being. And when well-being exists, you don't need expensive medical services. So that really flips it on its head to understand that if we use the same bucket of money and reallocate it, we could be living so much better at home, using the technology, say, you have about understanding what's best to eat, or some brain games that might be helpful. those things are important. Those are not medical treatments, but they are quality of life, high functioning mechanisms that make life worth living.
Absolutely. So I've spoken to this, and I know you have worked on this for decades, the difference between the consumerization of healthcare, which is what we're talking about, and the medicalization of the consumer. And those are two very different things. And just because you might have medical treatments and medical payments come to the home, it might be better than being in a hospital, let's say, or a clinic, but it's still not the same as preventative, upfront wellness and health options. You know, we have our listeners can't see this, but I'm wearing an Apple Watch. The level of data that you can now get passively on someone, and also actively if there's a fall or if there's some sort of issue with heartbeat, let alone walking and temperature and oxygen level in the blood and so forth, is incredible. So I think just the combination of technologies and ease of use and meeting people where they are, which is in their homes, and even if they're in a senior living home, nobody wants to go to the next stage of care. So if you're in independent living, you want to stay there. You don't want to go to assisted, and from assisted to nursing home. I remember a conversation I had, almost the opposite of what we're talking, what SCAN does, with a very wonderful, esteemed CEO of a large hospital. And my question was, as a leader of a healthcare institution, what energies and efforts and investments do you make to literally have people stay away from your doors? And the honest answer was, we can't afford to do any of that. And the reason was, if they did, they prevented people from coming in, they would actually ultimately lose contracts because their costs would go up, and they would essentially make their neighborhoods safer and healthier for the competition, but not for themselves, because their costs would go up. And that just struck me as both honest and unfortunate. And I don't know how we can change that in the hospital systems, but that always struck me as an important point. And I know you have some views on hospitals and, fantastic places to fix some things, but where do they fit in the bigger picture in the continuum of care?
Sure, certainly. Well, hospitals, like other industries, have to begin to move with the fact that the world has changed. I think at one point, hospitals were kind of the white knights of healthcare, that's where all good things happen. You go in, you have a big issue, you get cured, or at least have your situation managed, and you go home better and hopefully well. So that was 1.0 hospital. We're at a time now that the hospital isn't in isolation. The hospital is a partner of the well-being of people, but most people don't need to go to hospitals if it's a medical condition. And there's some research and programs now that show, like if you had a very bad heart condition like congestive heart failure, or your pulmonary issue is out of control, it has been shown that you can actually manage this outside of a hospital and do it well, safely, for less money and less risk of infection, less risk of delirium. So if that's the case, how do hospitals look at who they are in this century and in the future? So it calls for some, again, re-innovation, not just using the 1.0 system of only doing well when people show up in your hospital very sick, because when they're very sick, you can charge for more services. But that's about payment for doing things rather than payment for helping people stay safe and well. So I think it's a 2.0 time for hospitals to think about what their role is. They are crucial, no question about it, but how do they serve society, get paid appropriately, and be able to have a business model that will work while having society be better off?
Jennie, in the past, you've mentioned education is health, which is such a powerful statement. I've had the good fortune to serve on a local United Way chapter in San Diego, and our entire focus was education of children, particularly K through third grade. And the statistics of what happens when a child doesn't read at a proper level by third grade and health issues, drug issues, dropout of high school issues, everything that you can imagine gets much, much worse. Tell us about your concept of education as health and what can be done more and better in that area.
Well, it's certainly obvious that I've worked primarily focused on older individuals, but I've always felt that, and I have actually a public health background, to think about children and doing that kind of well-being work that I talked about for older people early on. And education is defined a lot more specifically for young children, as you're pointing out, but children in terms of their literacy, in terms of their feeling that they can participate and be seen when they're little, and that they have friends and they feel safe. All of that is part of well-being at the front end. And children can learn things. Just think about the fact of how smoking has declined. The target of that campaign was really children, the children who really learned about smoking when they were in elementary school. And they have been a major instrument of change for society, while again learning about well-being themselves. So one of the things I didn't mention is I am that much more focused on intergenerational connections and interdependency, because we don't do well when we focus only on age groupings of people, because if we're having a healthier society, we need to have better intergenerational connections once again.
Absolutely, and I'll share here without making any product announcements that that's something that we would love to offer over time, and it's been in the works and in design phases at different stages, where leveraging the TV to bring different groups together, and again curated, vetted, a secure way, where a child who might need wisdom from an older adult can benefit from that, and an older adult who has so much wisdom and experience but might need social engagement and the wellness that comes from the feeling of contributing and making a difference, then engage with a child. So we hope to be able to offer similar services that you just touched on down the road. We think that's really powerful.
You know, one other thing, Kian, I have talked to you about in the past that today gives me another platform. You know, I am now in my 70s, and I have been blessed that I could do all the things that I do, and the fact that I happen to have doors that keep opening to me. But that's not always true for my peers. I haven't raised the matter of ageism, and so even though I feel fortunate, ageism is so pervasive, and frankly is a epidemic into itself, where people are not seen, they're dismissed. They oftentimes, even in medical care, people aren't taken seriously for some of the issues that they're facing, or the issues that they're facing aren't valued as much as if you were a middle-aged adult. So between medical care, feeling that you're visible, working at jobs so that you are able to do your job regardless of what your age is. And when I speak of ageism, I'm showing the bent of older populations, but there is ageism on the other hand for young people who are bright, capable, and able to do more, but they too are discriminated against, perhaps because they happen to be, quotes, too young. And so I think this is one of the aspects of society right now, that we have so much loneliness, we have deaths of despair that we see in the news. Our ability to really understand people have capacity, have contributions, and yes, they may have needs, but don't we all? So we need a reframing and a reoperationalizing of what it is to participate fully in society.
So well said. And again, anything that you are focused on, I know good things come of it for all of us, and at a big picture level. So I couldn't agree more. Richard is, been a leader at Independent for now 12 years. And I never see him in any kind of an age. I see him as a partner, and he contributes and actually goes well beyond his medical and social care background, and does marketing and tests out the product, and goes, of course, to meetings as a business executive, but also just is such a joy to do so many things. I really couldn't imagine independent without him. And that's a good point. Maybe others are not as good, don't have the same good fortune of, you and Richard, and maybe people view them differently. So we have to be mindful of that. So Jennie, you're a proud grandmother, and you've made change to create a better environment for all of us. For your grandchildren and for the rest of us, what else can you see in the future? Where's your biggest excitement, and or where are your biggest concerns after all this?
Well, I am so delighted. My grandchildren actually marched over these past couple of years for Black Lives Matter. I think our younger population is being exposed to complex issues in ways that I never got exposed to quite the same way at their age. So I think their sensitivity, their awareness, their activism, and then from us, that sense of their well-being, because we realize how important early education is. I am thrilled that our grandchildren's school truly emphasizes physical activity as well as helping one another, leadership development. And this is still in primary school. So I am optimistic that we need to understand their potential, and we need to also listen to their voices on climate change, because we will be gone, but they will be inheriting all of this. So we need to be working actively with them and for them, and to make sure that not only are we having a decent social society, we need the air and water that is going to be important for any world well-being. And these are some things our young grandchildren are facing and learning about right now. So I am so glad that they are engaged, and I hope that more children will continue to learn these areas of knowledge and develop skills and learn to work with one another collaboratively, so that they can really solve problems in the future.
Jennie, I recall a quote from you regarding an enduring ethical society. And it reminds me of this adage where a society can only be judged, or best be judged, by how it's treating its most vulnerable, its most frail. And to our conversation, those are the frail populations that we talked about under PACE and other areas that you've dedicated your career to, and also our children, really the ones who may not have the same vote and voice and impact, but define our future. So I can't thank you enough for helping our society be judged better with all the work that you've done and are doing, and I'll leave you with any final thoughts.
Oh, I'm just grateful. I think that the ability to facilitate capacity, and I think Independa is built on that. And that means that same concept for all of us, regardless what our roles are in society, we're built to do something. And so our ability to unleash that possibility, and the fact that we can contribute, and we can also feel confident that when we may have needs, that society will also be there for us. So let us build on the give and take of contributing to a functioning society, spend the time doing the hard work of building this infrastructure, and being respectful of each other so that the dignity of the human person can show. So I think between your emphasis and hopefully my emphasis, that we continue our collective partnership to leave this world better than we came upon it.
Jennie, thank you for being such an inspiration to me personally, and for all that you have done and continue to do. Makes all the difference. Thank you so much for your time. I really, really enjoyed our time together. Have a beautiful day.
Thank you.
Thanks for listening. We always would love to hear your thoughts and suggestions. You can leave them for us at podcasts@independa.com. That's plural, PODCASTS. independent.com, and make sure you follow us on your favorite podcast platform. I'll be ruminating with more thought leaders on future podcasts and do hope to see you then. In the meantime, stay healthy and happy.